Happy Friday, Melrose. It's Mayor Paul Brodeur here with the weekly COVID-19 update. The weekly COVID-19 case data for Melrose, published by DPH on October 14th, or yesterday, shows where we're at. Our percent positivity rate is at 1.6%, while the statewide average is at 1.82. Our average daily incidence rate per 100,000 is at 14.5, and the statewide average is at 19. I am happy to report that all these numbers are lower, both at the city and statewide level, and are trending in a good direction. Now, Melrose also continues to show positive data around vaccinations, with slight increases in most categories over last week. Our overall vaccination rate is at 73%. Now, this percentage reflects the fact that residents under 12 are not yet eligible for the vaccine. And our lowest rate of vaccination of eligible residents is in our 12 to 15-year age group. However, 76% of that group are vaccinated, and 82% of our kids from 16 to 19 are fully vaccinated. And you can see complete data for this, again, on the DPH website. And another reminder about booster shots. Individuals who are immunocompromised due to particular health conditions have been eligible for a booster dose of Pfizer or Moderna vaccine since August 13th. And the following individuals who got the Pfizer vaccine are now eligible for a booster dose 6 months after their second shot. That includes people who are 65 or older, residents in long-term care settings, people age 50 to 64 with underlying medical conditions, and certain people aged 18 to 49 with a particular set of underlying medical conditions. And folks from 18 to 64 years of age who are at increased risk of COVID-19 exposure and transmission because of their occupational or institutional setting. Now, like the original shot, the booster is free and is very easy to get. Please check in with your doctor if you have any questions about your eligibility or for advice on where to get the shot. Now, the most important question is, why get vaccinated and get the booster? Well, because they work, and they are the single most important tool for protecting our community from infection and spread of COVID-19. While a vaccine is not 100% guaranteed that you will not get COVID, it does greatly reduce the chance of infection, hospitalization, and death. As of October 9th, the most recent data from DPH, over 4.66 million residents of Massachusetts have been fully vaccinated. That's great news. Now, of these, 44,498 have had breakthrough infections, which sounds like a big number, and it is. However, that is 0.95% of those fully vaccinated in Massachusetts. Put another way, less than 1 person out of every 100 who have been vaccinated have since gotten the infection. And of those, 1,428 have been hospitalized, which represents 0.03% of those fully vaccinated, and 345 residents known to have been fully vaccinated have passed away. And that is tragic, but that represents only 0.007% of those fully vaccinated. There is a chart on the screen summarizing this information for you. So if you have not yet done so, I again urge you to get vaccinated and to do the same for family members 12 years of age and older. It is easy to get an appointment, and again, there is no charge for the vaccine or the booster. And finally, please remember, you've heard it from me 1,000 times, the recommendations of our public health experts have not changed. Wash your hands frequently, maintain social distancing, and whenever possible, wear a mask when indoors or in crowded settings, particularly if you are unvaccinated. And stay home when you are sick or have symptoms, and get tested often. There are a lot of great events happening in Melrose this weekend, so please get outside, have some fun, and stay safe.